So today we will be talking about the armamentarium of the dental anesthetics. So what is the armamentarium? It is necessary to administer local anesthesia are the cartridge, needle, and syringe. So armamentarium, in other words, are who are those equipment needed for the equipment needed for the administering anesthesia. So there are three components, important components: the needle, the cartridge, and the syringe. So it is first is the syringe. It is one of the three essential components of the local anesthetic armamentarium. It is the vehicle whereby the content of the anesthetic cartridge is delivered through the needle to the patient. So there are four types of syringes: the non-disposable syringes, safety syringes, computer-controlled local anesthetic delivery systems. So first, we will have the non-disposable syringes. So breech-loading metallic cartridge type aspirating syringe. So it's the most commonly used in dentistry. So the term breech-loading implies that the cartridge is inserted into the syringe and from the side of the barrel. The needle is attached to the barrel of the syringe at the needle adapter. The needle then passes into the barrel where it penetrates the diaphragm of the local anesthetic cartridge. So next is the breech-loading plastic cartridge type aspirating. So it is a plastic reusable dental aspirating syringe which is available, that is both autoclavable and chemically sterilizable. So next is the breech-loading metallic cartridge type self-aspirating syringe. So the incidence of a positive aspiration may be as high as 10% to 15% with some injection techniques. So it is accepted by the dental profession that as an aspiration test before administration of a local anesthetic drug is of great importance. Unfortunately, it is abundantly clear that in the actual clinical practice, too little attention is paid to the procedure. So the next is the jet injector, the last kind of non-disposable syringes. So it is based on the principle that liquids forced through very small openings called jets at very high pressure can penetrate intact skin or mucous membrane. So the advantages of these jet injectors: it does not require the use of a needle. So it is recommended for those for persons with needle phobia. So it delivers very small volumes of local anesthetic placed in topical anesthetic, inadequate for pulpal anesthesia or for region block. Some patients are disturbed by the jolt of the disadvantages. Inadequate for pulpal anesthesia or for region block. Some patients are disturbed by the jolt of injection, the cost, because it is expensive since it is not the type of injection. So, and it may also damage periodontal tissues. So next we move to the pressure syringes. It is reintroduced in the late 1970s. They brought about a renewed interest in the PDL injection, also known as intraligamentary injection. So the advantages of pressure syringes: it has a measured dose, overcomes tissue resistance, non-threatening, and cartridges are protected. Disadvantages, however: it is easy to inject anesthetic too rapidly, threatening also. So next is the safety syringe. It minimizes the risk of an accidental needle stick injury occurring to a dental health provider with a contaminated needle after administration of a local anesthetic. These syringes possess a sheath that locks over the needle when it is removed from the patient's tissues, minimizing the risk of accidental needle stick. So the advantages: disposable, single use, sterile until open, and it is a lightweight. These are the syringes, the ones we use for vaccines and stuff. So the disadvantages requires additional training and may feel awkward to a first timer. So next part is the needles. So it is the vehicle that permits local anesthetic solution to travel from the dental cartridge into the tissues surrounding the needle tip. So virtually all needles used in dentistry are stainless steel and disposable. Needles manufactured for dental intraoral injections are pre-sterilized and disposable. So anatomy of a dental needle. So the needle is composed of a single piece of tubular metal around which is placed a plastic or metal syringe adapter and the needle hub. So the bevel defines the point or the tip of a needle. So there are a variety of bevel types available on dental needles. So its function is to provide a cutting surface, allowing the needle to penetrate mucosa with as little resistance as possible. So the shaft of the needle is one long piece of tubular metal running from the tip of the needle through the hub, continuing to the piece that penetrates the cartridge. So next is the gauge, refers to the diameter of the lumen of the needle. The smaller the number, the greater the diameter of the lumen. A 30 gauge needle has a smaller internal diameter than by a 25 gauge needle. In the United States, needles are colored by gauge. Gauge, whatever. I'm not sure of the pronunciation, by the way. So the next is the cartridge. It is a glass cylinder containing the local anesthetic drug among ingredients. So it is the one that contains the anesthesia or whatever you store. So by common usage, dental professionals as a carpule. Carpule is actually a registered trade name for dental cartridge prepared by Cook-Waite Laboratories, which was introduced into dentistry in the 1920s. So there are also additional armamentarium, which are the topical antiseptic, topical anesthetic, applicator sticks, cotton gauze 2 by 2 inches, hemostat, and needle recapping device. That would be all. Thank you.